Performance enhancement. Introduction to the module. This module will elaborate on the various performance enhancement medicines and techniques used in sports. You will also learn how these enhancers work and their unfortunate side effects. Topics to be covered: doping, anabolic steroids, blood doping, growth hormones, stimulants, amphetamines, caffeine, cocaine, painkillers, beta-adrenergic agents, beta blockers, beta-2 agonist, the health risks and side effects. Doping. Doping is the use of prohibited athletic performance-enhancing substances by athletes in professional sports. The word doping is commonly used by organizations that oversee athletic competitions. Many international sports bodies, including the International Olympic Committee, consider the use of performance-enhancing drugs to be immoral and, as a result, forbid their use. Furthermore, athletes, or athletic programs, who take explicit steps to avoid detection worsen the ethical breach with blatant deceit and cheating. The demand for performance-enhancing drugs has been fashioned by society's fixation on winning races to looking more physically fit. Doping has developed into a widespread problem in competitive and high-performance sports due to increasing professionalism and commercialization. Athletes are paid more money, and they also gain greater fame if they are better. These incentives are adequate to drive athletes to abuse performance enhancers, especially those unnoticeable by standard measures. Anabolic steroids. Ancient texts reveal that Greek Olympians ate sheep testicles. Today, we recognize this act as a source of testosterone. Steroids are a class of drugs similar to testosterone. They can have anabolic, muscle-building, and androgenic, increased masculine characteristics, effects. Their use involves 3 administration techniques: cycling, stacking, pyramiding. Anabolic steroid abusers get steroids through magazine ads, other athletes, gyms, and occasionally, by prescription from a physician. Steroids that can be obtained through the black market or clandestine laboratories and foreign sources are not of good quality, contain unknown or harmful ingredients and are often manufactured in non-sterile facilities. One possible side effect in adolescence is premature growth halt due to premature maturation of the skeleton and accelerated puberty changes. This means that adolescents risk stunting their growth for the remainder of their lives if they take anabolic steroids before the typical adolescent growth spurt. Also, there are some gender-specific side effects. For men, shrinking of the testicles, reduced sperm count, infertility, baldness, development of breasts, and increased risk for prostate cancer. For women, growth of facial hair, baldness, changes in or cessation of the menstrual cycle, enlargement of the clitoris, and a deepened voice. Blood doping. During exercise, the body needs more oxygen than when at rest. Red blood cells carry oxygen. Because of that, many athletes increase their amount of red blood cells by training at high altitudes. The decreased oxygen levels at higher altitudes drive the body to produce more red blood cells to compensate. After training under these conditions, the athlete acquires a greater capacity for carrying oxygen in the blood. When athletes then compete at lower altitudes, they can have double the capacity to carry oxygen and thus less fatigue compared with competitors. Athletes can increase their amounts of red blood cells by using non-natural ways, too. Blood doping is one such way and an acute problem in sports. It involves either a blood transfusion of red blood cells or administration of the drug erythropoietin, which pharmacologically increases red blood cell mass. Blood doping improves an athlete's ability to perform better and reduces physiological strain. Athletes must carefully weigh the decision to experiment with blood doping. This procedure is associated with health risks amplified by dehydration and environmental stress. Growth hormones. Growth hormones make up about 10% of the dry weight of the pituitary gland and appear to affect the growth of nearly every organ and tissue in the body. Athletes are turning to growth hormones because they believe that they can provide many of the benefits of anabolic steroids while being difficult to detect. They use growth hormones to increase their size and strength or height. No studies have proved any short-term effects of its use. Also, because it is an injectable drug, there are added risks of HIV and hepatitis infection resulting from sharing needles and syringes. Stimulants. An athlete uses stimulants to reduce tiredness and increase alertness, competitiveness, and aggression. They are more likely to be used in competition, but they are also used during training to increase the intensity and benefit of the training session. Major categories of stimulants are amphetamines, caffeine, cocaine. Amphetamines. Amphetamines stimulate the central nervous system and induce a fight-or-flight response. It is hypothesized that these drugs may increase all types of performance because of the stimulatory effects. Amphetamines amplify arousal. Because of that, rates of breathing and air exchange in the lungs increases. Amphetamines bind to adrenergic receptors and exert effects such as increased blood pressure, heart rate, and metabolic rate. In addition, they increase the plasma-free fatty acid concentration in healthy subjects, thus providing fuel for muscles and sparing muscle glycogen, thereby delaying the onset of muscle fatigue. Caffeine. Caffeine is present in coffee, soft drinks, and many non-prescription drugs. It is one of a few substances with documented efficiency and minimal side effects. It affects signaling in cells and increases the production of chemicals that allow the body to adapt to the stress created by physical exercise. Caffeine significantly increases ventilation at rest, lengthens task endurance time, and reduces the perception of fatigue. Like amphetamines, caffeine mobilizes fat and helps to preserve glycogen stores in muscle. Cocaine. Cocaine has two main pharmacological actions. It is both a local painkiller and a central nervous system stimulant and is the only drug known to possess both of these properties. Cocaine is a stimulant as it affects several neurotransmitter systems. With the continued escalating use of cocaine, the user becomes progressively tolerant to the positive effects, whereas the adverse effects steadily intensify. Few studies suggest that performance gains are incurred from cocaine use. The sense of euphoria may provide the illusion of better performance when, in actuality, performance is not improved but may be even impaired. Painkillers. Pain is the body's way of signaling injury. The chances are good that more pain equals worse injury. By consuming narcotics, the athlete can mask the pain and continue to play, thus placing the athlete in great jeopardy concerning tissue overload and failure. One study examined the attitudes of student athletes toward the use of pain-killing drugs. Cyclooxygenase 2 specific inhibitors are emerging as primary treatment for sports injuries because of their analgesic and anti-inflammatory effects. Specifically, they decrease excessive inflammation and the pain associated with inflammation. The overall effect produces less swelling, leading to better healing. Beta-Adrenergic Agents. Beta blockers. Various cells in the body express beta-adrenergic receptors on their surface. Beta-adrenergic blocking agents block these receptors and are used in the treatment of high blood pressure. Beta blockers work by affecting the response to some nerve impulses in certain parts of the body. As a result, they decrease the heart's need for blood and oxygen, thereby reducing its workload. They also help the heart to beat more regularly. Beta blockers can reduce heart rate and tremors and improve performance in sports that are not physiologically challenging but require accuracy. However, beta blockers may work so well that they can actually impair aerobic performance by slowing down the heart too much. Beta-2 agonist. Other agents can activate beta-adrenergic receptors and produce a stimulant-like effect in the body. Short-acting beta-2 agonists relieve asthma symptoms very quickly by immediately opening the airways. Long-acting forms provide control, not quick relief. Beta-2 agonists can act as both stimulants and anabolic agents. Several studies have shown that these drugs increase skeletal muscle mass or function. Clenbuterol is often mistaken in the popular media as a steroid, although in fact, it is classified as a beta-2 agonist. The health risks and side effects. As with any other drugs that affect your body, there are various unwanted and significant side effects, such as cardiomyopathy, liver toxicity and liver cancer, male sterility, gynecomastia, masculinization in females, stunting of growth in children. Other side effects: acne, baldness, aggression. Cardiac and liver problems represent significant health risks. A recent examination using echocardiography in powerlifters and weightlifters indicated an unhealthy thickening of the left ventricular wall in those using steroids. And importantly, minimal recovery in those who had stopped using steroids for at least 1 year. This lays to rest another myth amongst abusers that any harmful effects will rapidly reverse on stopping use. Summary. In this module, we have covered the following. Doping is the use of prohibited athletic performance-enhancing substances by athletes in professional sports. One possible side effect in adolescence is premature growth halt due to premature maturation of the skeleton and accelerated puberty changes. Blood doping is one such way and an ever-increasing problem in sports. It involves either a blood transfusion of red blood cells or administration of the drug erythropoietin, which pharmacologically increases red blood cell mass. Growth hormone makes up about 10% of the dry weight of the pituitary gland and appears to affect the growth of nearly every organ and tissue in the body. Stimulants may be used to reduce tiredness and increase alertness, competitiveness, and aggression.